If you're heading into Medicare, I want to talk about 3 things that could save you, and I'm not exaggerating, thousands of dollars. It's about your dental, vision, and hearing care. Here's a fact that shocks millions of Americans, usually right after it's too late. Original Medicare, that's Parts A and B, does not cover routine stuff like dental cleanings, fillings, eye exams for glasses, or hearing aids. So many people don't find this out until they're staring at a bill for a new pair of glasses or a dental crown, and the sticker shock is real. But it doesn't have to be that way. In this guide, we're going to cut through the confusion and show you how to get the comprehensive care you deserve. We'll break down how to fill those coverage gaps, so you can have peace of mind and a healthcare budget that doesn't have any nasty surprises. Stick around, because knowing your options is the first step to saving a ton of money. So, why doesn't the federal health insurance you've paid into your whole life cover these basic services? It really comes down to a history lesson. When Medicare was created back in 1965, it was designed to protect seniors from the wallet-busting costs of hospital stays and major medical problems. Think of it as your safety net for surgeries, doctor's visits, and emergencies. Routine care for your eyes, ears, and teeth just wasn't on the menu back then. Because of that, Original Medicare has some pretty clear rules about what's not covered. This means you're on your own for routine dental. Things like your regular checkups, cleanings, fillings, extractions, and especially major work like dentures or implants are not covered. Routine vision. Our standard eye exam to get a new prescription for glasses or contacts? Not covered. The glasses and contacts themselves? Also not covered. Hearing aids. Medicare might cover a diagnostic hearing exam if your doctor orders it to check for an underlying medical condition, but the hearing aids, which can run thousands of dollars, are not covered at all. Now, there are a few very specific, very narrow exceptions. Part B might cover an eye exam if you have diabetic retinopathy, for instance. And Part A might cover a dental exam you need in a hospital before a major surgery, like a heart valve replacement. But for 99% of the day-to-day dental, vision, and hearing needs we all have, Original Medicare leaves you with the bill. This is easily the biggest and costliest shock for folks new to Medicare, but the good news is, you have some powerful ways to fix it. If Original Medicare has these huge gaps, how do you actually get the coverage you need? It's not as tricky as it sounds. You've basically got 3 main paths you see. By far the most popular way people get these benefits is with a Medicare Advantage plan, also called Part C. These are plans from private insurance companies that bundle everything together. You get your Part A hospital coverage, Part B medical coverage, and usually your Part D drug plan all in one. And here's the best part. Because these private insurers are competing for your business, they pack in extra benefits. As of 2026, the vast majority of Medicare Advantage plans come with dental, vision, and hearing coverage built right in. What does that look like? For dental, a typical plan will cover your preventive care like cleanings and exams, often for a $0 copay. They also help with basic work like fillings and even major stuff like crowns and dentures, usually up to a yearly limit of about $1,000 to $2,000. For vision, you can expect an annual eye exam plus an allowance, often $150 to $300, that you can put toward a new pair of glasses or contacts. And for hearing, plans usually cover your routine hearing exam and give you a generous allowance for hearing aids, sometimes up to $2,000 per year. The biggest wins here are convenience and financial protection. You have one card, one plan, and one number to call. Plus, every Advantage plan has a maximum out-of-pocket limit, which is a cap on how much you'd ever have to spend in a year. Original Medicare doesn't have that safety net. The trade-off? You'll usually need to use a network of doctors, like an HMO or PPO, to keep your costs down. By far the most popular way people get these benefits is with a Medicare Advantage plan, also called Part C. These are plans from private insurance companies that bundle everything together. You get your Part A hospital coverage, Part B medical coverage, and usually your Part D drug plan all in one. Standalone dental insurance. You can buy a private dental plan for about $25 to $60 a month. It'll cover your cleanings right away, but, and this is a big, but, watch out for waiting periods. Many plans make you wait 6 to 12 months before they'll help pay for major work like a root canal or crown. Standalone vision and hearing plans. You can also buy separate vision plans that cover your yearly exam and give you an allowance for glasses. While full-on hearing insurance is less common, you can find plans or discount programs to help tackle the high cost of hearing aids. This path gives you maximum flexibility with your doctors, especially if you also have a Medigap plan to help with your other Medicare costs. The downside? You're juggling multiple plans and multiple premium payments, and it can sometimes end up being more expensive. This path gives you maximum flexibility with your doctors, especially if you also have a Medigap plan to help with your other Medicare costs. The downside? You're juggling multiple plans and multiple premium payments, and it can sometimes end up being more expensive. The third option is to skip the insurance altogether and either use a discount program or just pay out of pocket. A dental or vision discount program isn't insurance, it's more like a membership club. You pay an annual fee, and in return, you get a discount card that gives you access to a network of dentists and eye doctors who offer their services at a reduced price, often 20% to 50% off. The great thing is there are no waiting periods and no annual limits. The downside is you're still paying the full bill, it's just a smaller bill. The final option is simply paying for everything yourself. If you have perfect teeth and only need one cleaning a year, this might sound tempting. But it's a risky game. One surprise root canal and crown can easily cost thousands of dollars, which can quickly add up to more than you would have spent on premiums for a good plan. No matter which path you're leaning toward, you've got to read the fine print. Paying attention to these few details can be the difference between a good deal and a bad surprise. First, provider networks. If you choose a Medicare Advantage plan or a standalone PPO plan, always check if your favorite dentist or eye doctor is in-network. Going out of network can mean paying a lot more, or the plan might not cover it at all. Second, annual maximums. This is huge for dental plans. An annual maximum is the absolute most the insurance company will pay for your dental work in 1 year. If your plan's max is $1,500, you're on the hook for 100% of the costs after that until the plan resets next year. Third, waiting periods. Like we mentioned, some standalone dental plans make you wait before they'll cover big ticket items. If you think you might need a crown or bridge anytime soon, this is a critical detail to check. Finally, know your copays and allowances. A copay is a flat fee you pay for a service. An allowance is a set amount the plan gives you for a purchase. If your glasses allowance is $200 and you pick out frames that cost $350, you'll pay the $150 difference. Okay, let's bring it all home. While original Medicare is a great foundation, it leaves you exposed when it comes to routine dental, vision, and hearing care. The great news is you have control. You can fill these gaps with an all-in-one Medicare Advantage plan, by buying separate standalone policies, or by using discount programs. Each one has its pros and cons, and the best choice really comes down to your health, your budget, and what's most important to you. You don't have to accept thousands of dollars in surprise medical bills as just a part of life. Making this decision is a big deal, but you don't have to do it alone. The licensed agents at Camaraderie Health are experts who can help you compare all the plans in your specific zip code, totally free. We can check if your doctors are in network, go over the fine print, and help you find a plan that's a perfect fit. Just click the link in the description to schedule a free, no-obligation chat today. And if you found this guide helpful, do us a favor and subscribe to the Camaraderie Health channel and hit the notification bell. We put out new videos every week with clear, simple advice to help you get the most out of Medicare. Thanks for watching. You are invited to subscribe to Camaraderie Health Agency YouTube channel or go to www.camaraderiehealthagency.com or call 224-433-5754.